Hey guys, it's Dr. Adam with a sip of aesthetics, and today we're talking about under eye fillers. So we're gonna cover this topic in details. We're gonna talk about who's a candidate, who's not a candidate, what is under eye fillers, what are some other treatments, what are some things to watch out for. And to help me talk about this topic, I have over here Samira, who's been with us for a while, and she's been doing this type of treatments for a very long time. So it's good to have you here.
Thank you for having me. I'm excited. I
Awesome.
like this stuff.
Perfect. And it's your first time with us here, so if you want to give a quick
Yes.
introduction
I'm
to our listeners.
Samira. I'm a PA. I've been in aesthetics for close to 15 years, injecting for 8 of them, and it's what I love to do. It doesn't feel like work, so
So,
I'm lucky.
how do you feel about under eye fillers, that area? Is that something you like to do, you don't like to do? What's your overall
So
impression?
I have a bone to pick with some of my patients and other fellow providers when it comes to under eye filler, because I feel like over the course of time we've really learned a lot more about anatomy and the right filler in the under eye area especially, and who the right candidate is. Haven't you had, Dr. Adam, like those patients that have come to you and sat on your chair and they're like, dude, I have hollow eyes, I need the under eye filler, but you look at them and they have these like big fat pads just sitting there and you're like, that's not hollowness, and you're definitely not a candidate.
Yeah. And I think that's something that we can talk into, because I think what happened is because under eye fillers in the right candidate can make a huge difference.
Huge.
And so people will see this before and after, and now anytime that somebody doesn't like their under eye, they think, oh, I can just, get under eye fillers and it's gonna look amazing. Whereas, as you've mentioned, it's a great tool for the right candidate, but you have to pick the right candidate for it first.
Exactly. I think that hollowness, it needs to be explained to the patient a little bit more. Like, I think I'm a pretty good example of hollow, where like my skin is like down to bone. There's nothing squishy, there's no tissue. That is a true hollow under eye. And that is the person that is a great candidate for under eye filler.
So who do you usually like? What's like one big mistake that you see that people are coming in thinking that the best thing to do for them is under eye filler, but you're like, that's not really what you have. What you have is something different. Can you give like a couple examples of these?
I would definitely say people who need lower blepharoplasty, which is a procedure that takes out that excess bag or the fat pad, or what we call a herniated fat pad. That's the most common one that I personally see. And the reason why I try to explain to patients, because I do know that there are some patients that do get under eye filler and then they run into a lot of complications. And that's when I generally see them. Whether I have to tell them, hey, sorry to break it to you, but you were never a candidate in the first place. And now look, we have a lot of lymphatic pooling or edema in your under eye that we need to potentially correct. That's something that I take on a case by case, because that vicious cycle when it comes to the under eye of filling, dissolving, filling and dissolving. And at that point, I feel like patients become more filler dependent. And when I do dissolve them, it becomes more of a shock, because they're like, shoot, what happened to all that volume? But what they don't realize is that was a lot of lymphatic fluid that's been pooling up there. And that's not what we want for that patient, right?
So I know you already mentioned it a little bit, but maybe for our listeners, we can just again like readdress it maybe in a little bit more details. Like exactly who would be a good candidate. If you're listening to this and you're wondering, like, am I a candidate? I mean, one thing is if they have bags, and this isn't an alternative to getting a consultation with somebody who is knowledgeable, because they can kind of walk you through it. But you do wanna walking into that consultation, you wanna have some kind of understanding to see if the person you're talking to is making sense to you, if you feel comfortable with them. But if you are sitting here listening to this conversation, how do you know if you're a good candidate? You already mentioned that if you have a big bag, then that might be not the best candidate, but what are the things that they should look for?
I also ask if a patient is like someone who's super allergic or has like seasonal allergies. So those are people that generally do pull a little bit more fluid in that area. So I ask, do you wake up in the morning feeling extra puffy in the eyes, and then as the day progresses it gets better? If their answer is yes, I know that I need to be a little bit more cautious if I'm going to do under eye filler, as well as Botox. Because another thing is that, as you may already know, our muscle around the eyes is the orbicularis oculi muscle, and that's what we treat when we're treating crow's feet. And for those types of patients, or for patients that do have a little bit of lymphatic interruption in the area, that muscle is kind of like a sphincter muscle. It's kind of a pump to get that lymph fluid out. So if you're relaxing them completely, that pump is ineffective and they get more pooling there too. So that's another question that I like to do. And I also like to kind of do like a pull test to see the turgor of the skin. That's kind of like another way that a tool that I use to see if, hey, is this an appropriate patient that can handle the filler in the area?
Yeah. Yeah, and I think that's why, like, when you're talking to a provider, like, because sometimes we try to pile all these different treatments on top of one another. And again, I'm a huge fan of doing multiple treatments when they have that synergistic effect, but at the same time, you want to be aware not to, pile the wrong treatments in the wrong patient, whereas in a different patient, it might be a great option. And, not to scare everybody who's listening, because as we've started by saying, some people, if you have healthy skin, if you just have mainly hollowness under the eyes, that's making you look a little bit more, like tired, not as awake, and you are the right candidate for fillers, then it can be life changing. I mean, it can make a huge difference in people, and people like just this. It's in one of these areas where just a small improvement can make a huge overall improvement in the face.
Absolutely agreed. I think it's one of, if the person is a candidate, it's such an underrated area. I think I just did one the other day that, I mean, she looked so tired. I just posted it too. She looked so tired. And right after, the best thing about filler is it's that immediate gratification for the patient, because they're looking in the mirror and you could see it because it's a hyaluronic acid gel that's being injected. So she was like, oh my God, I feel like what I looked like 10 years ago before kids. And I'm like, well, that was the plan. Like, that's what we want.
Yeah. Don't you love it when you see these clients where you finish and you look at it and you're like, wow, I did a good job. Like, it's even better than I expected.
That was the moment that I actually, and it's funny because even while you're injecting, you're kind of like, you don't realize everything until after the fact, and then you see your before and after, and I was like, whoa.
Yeah, exactly.
And I called the front desk because she was already up front paying, and I was like, you guys, can you please just ask her, will she be okay with her before and after? Because this is amazing. And she was so nice to let me do that.
So the first step is we have to see if you're a right candidate. Now, say somebody is a good candidate for it. Now, I guess, another step would be because as you've mentioned, there's so many different types of fillers. Like, how do you choose the right product for that person? What are some things that you are looking for?
Okay, so I'm a crazy person when it comes to this stuff, because when you're starting off in aesthetics, we only had 2 types of fillers to really work with. And once you see things play out into the population, these companies, thank God, they do catch on really quickly, and they're like, okay, we really need to improve the technology behind these fillers. So I truly take so much pride in under eye, and I think it's so important to stay away from hydrophilic fillers, which means the fillers that love water and they draw in more water, because that's not what I'm looking to do. So my personal favorites have been just the classic Restylane, Bellotero, and more recently Redensity has been like so pretty in the area, and I love it because I could come extra superficial with it, and it's my favorite. It looks so good.
And as we were talking a little bit before, part of the problem with this area is that it can like swell up, and the skin in our under eyes is very thin, whereas swelling will kind of show easily. So that's the problem with using a filler that's going to be hydrophilic, that's going to attract a lot of water. It can cause more swelling than we'd like, which is why, as you mentioned, a lot of the fillers that you mentioned, they tend to be very soft in a sense, and they're not going to attract tons of water, and they're not like very, like in other areas of the face we might want to use something that's more firm,
Robust,
that's good, exactly, whereas we want something more soft in that region.
Exactly. And one other thing that I would always say about the under eye filler, because I've also seen this happen to patients, is injecting in the right plane of the skin. Because have you ever, you've had that patient that sits there with that little sausage in their tear trough, and you're like, how do I tell her without making her feel bad about this? So I think that's really important. So really making sure that you know what plane of the skin that you're in when you're injecting is super important. And safety. So I personally do love using a cannula in that area. It's a very vascular area, so patients tend to love the fact that it minimizes the chances of bruising for them.
Yeah.
But you know, there's always that need for a little needle work for that precision that sometimes, depending if like we're homies and they know my work, and I do try to minimize bruising, and if they're okay and they don't have any major events coming up, I'll sneak in a little needle there.
Exactly. No, I'm the same way. I mean, I love to use a candle when I can, but sometimes we do use a needle for certain, like, defining certain things. Exactly.
Yeah.
But the client is always aware that usually when we use a needle, there is a higher risk of getting a bruise, and bruises in that area are not fun, but they tend to resolve. What are some of the potential complications? We already mentioned some of them, in terms of like, especially when there are certain complications that can happen, with anything. So you do have to be, aware, you have to be informed. But there are things that we can really minimize the risk of just by using the right product. As you've mentioned, it's not going to absorb a lot of water, being in the right plane, which is important in all, like no matter which area of the face you're injecting. But especially in the under eye, because the skin is very thin and you don't have a lot of planes.
It's the thinnest skin in our whole body. Like, it doesn't get thinner than that.
And there's even a Tyndall effect in some patients where if you inject the wrong type of filler,
product, you'll get the Tyndall.
Yeah, you'll get that. It's that bluish discoloration that sometimes you can see under the skin from just the
way the light hits the skin.
And the interesting thing is, a lot of times people come in to do their under eyes because they
for
come
that
in
reason.
Exactly for discoloration, because it's like it looks darker.
And then you see someone who has that Tyndall effect, and you're like, oh man, it's worse.
Absolutely.
But I just think when it comes to any of this stuff, under eyes or not, it's so important to be vigilant and do your research. Look at your provider, look at before and afters, do research, and go to someone who is very knowledgeable in anatomy, someone who's staying up to date with education. Dr. Adam, how much is this stuff changing on it daily? Like what was working for us like even 2 years ago is completely changed now. Like even with this filler in the under eye, for example, we were injecting all sorts of stuff a couple of years ago, and now we're like, maybe not.
Well, there's always new products that are better suited that are coming out, or there's new FDA approval that are coming out, and maybe we've had something that was good, but now we have something that's better, that's great. So you always want to kind of, like you said, be up to date, and that's why you want to go to a reputable place that has that relationship, with carrying all the different products and not just kind of sticking to one. Always keeping up with the latest research, the knowledge that's out there, whether it's through conferences or other 100%. Modalities. No, and that's very important. That's why I know you do it too, and we're always in conferences doing these medical education hours, specifically in aesthetics, specifically in regenerative medicine. In the field that we're actually practicing day to day, because these things are evolving, especially today. These things are changing, and as you mentioned, in a couple years from now, we're going to have even better technology, even newer technology, and we want to be able to utilize that.
It's going to be great. I'm so impressed with how far we've already come.
What are other things that people can do for the under eyes? If somebody is like maybe not a candidate for fillers, or they just don't want to do fillers, what are some other treatments that are typically kind of, and we'll do a quick summary because I think we're running short on time, but maybe we'll visit that in a different episode.
I think my latest and greatest favorite one is the salmon DNA. If you don't know, you better ask somebody. That's my favorite. And I think that it's been really popular lately.
For sure. For good
And
reason.
if not that, PRP, PRF.
Yeah, biofiller is another kind of buzzword that's around right now, and I love that treatment too. It's basically PRP or PRF, and
Yeah.
it's kind of the PRP, but it's made more into a gel, so it kind of has more of that filler-like consistency. And this is can be done anywhere in the face, but especially in the under eyes. Also to help like rejuvenate the skin, give a little volume, stem DNA, as you've mentioned.
I
Is
think
common.
so.
And then there's always like also lasers and RF microneedling, Botox.
Absolutely.
But in terms of volume and collagen, I think
I
filler
think
is
those are
still,
the best. Yeah. Oh, of course.
absolutely.
I mean, and it just honestly, it also I'd like to piggyback off of this because I know that I think it's the most important that here at New, especially with you, Dr. Adam, me, all of our providers, we really take a very honest approach with our patients. And so I feel like patients shouldn't be upset when we say like, no, you're not a candidate for under eye filler. And I think you should actually be like, man, I'm happy that I'm going to a place that knows exactly what they're doing, and they're doing and recommending things for me that's not going to harm me, but only do better for me or be advantageous for me.
Yeah, no,
Because
100%.
I do feel like there are some patients that get a little like disappointed or like, why won't she do it? My other provider did it, but it's,
Yeah.
I'm doing this for you. It's your safety.
Yeah. And I understand where they're coming from. I think that's
Yeah.
where education and stuff is very important. And sometimes for what they're looking for, yeah, it's kind of like we said, especially now with all the
Yeah.
posts and stuff, they just see something and they think, this is
TikTok.
exactly, that's going to work on
The
everybody.
death of me.
Well, thank you guys for joining us. Thanks for coming in, Samira. It was
Thank you,
great
Brian.
pleasure.
That was fun.
We're gonna have you back shortly for sure
Yeah.
for more episodes. Hopefully you guys found this helpful. If you guys have any comments, make sure you leave it down below, like, subscribe, and we'll see you next week.